Hello everyone and welcome to Meddy Simplified. So now today we will discuss the important topics from the four main subjects that is P.S.M, Obs-Gynae, Surgery and Medicine. Each of this subject carry 30 to 35 marks in this Fmge exam. So make sure you at least do the three of out of this four subjects so that you can score a good marks in this exam. So starting with P.S.M first, that is preventive and social medicine. In India it is called as SPM in many of the places. So first important topic is levels of prevention, then screening, then vaccines, quality of life and indicators of health, that is Kali, Kali, and that kind of thing. Then definitions of disease and terms related to the management of disease, iceberg phenomena, a very important topic, then bioterrorism, category ABC, quarantine and isolation, and as it is very discussed topic nowadays, with even with the layman, in the layman it is becoming a layman term nowadays. So quarantine and isolation related questions can be asked. International Health Organization, WHO, UNICEF kind of thing, everything about them is very important. Disaster management, it is under which ministry, who is the head of disaster management, that thing is very important. Then epidemiology, whole topic of epidemiology is important. Healthcare system in India, that is primary health center, secondary health center, tertiary health center, then who work in which in each of them, uh, then ASHA workers, all these things are very important, which is included in healthcare system in India. Then the demography, that is an important thing. After that, biostatistics. Biostatistics as a whole is a very important topic, so you should do cover it very well also. And maternal and pediatric health, not so important, but usually questions are asked, so you should do it very well. And national health missions, national health mission, national rural health mission, all these things are important. Nutrition and malnutrition and related disorders, water and related topic, and purification of water, levels of water which is permissible for drinking, and chlorinated water, etc. kind of things. So all the topic related to water. Biomedical waste management is a very important topic, and because where after this Fmge you go for your internship, so you should at least know where to throw which kind of waste. So biomedical waste management is very important topic, and every year minimum one question is asked from this topic. Social and mental health, nowadays we are seeing a lot of depression and suicide related cases, so social and mental health can be also a very predictable topic for this exam. Occupational diseases, pneumoconiosis, all type of occupational related diseases, silicosis, anthracosis kind of thing is important. Then TB, all about TB, and RNTCP, revised National Tuberculosis Control Program, is important. Diphtheria and rubella, influenza disease, pneumonia, blindness, definition of blindness. Then for blindness there are different sectors, that is very important. Malaria, very common disease in India. National Vector-Borne Disease Control Program, that is NVVDCP, is a very important topic. NACP, National AIDS Control Program, also everything related to AIDS is also important. Sound frequency, permissible sound, that we also discussed in ENT also, so that is very important. And at last, Ebola and COVID, that is very recent disease and outbreaks, so it is important to know about them also through P.S.M. Now the next subject we'll discuss is Obs and Gynae. In Obs and Gynae, a very basic thing, that is the anatomy and physiology of the reproductive system is important. Then menstrual cycle and related disorders, amenorrhea, puberty and related disorders. This we also discussed in pediatrics, and it is also important in from either you do it from Obs Gynae or pediatrics, but you should do the pubertal disorders, that is puberty and related disorders. PCOD and PCOS. In last exam, approximately 3 questions were asked from PCOD, so it becomes a very important topic. And congenital malformations of uterus. In this topic, images are important. You should know the images very well, the radiographs for this malformations of uterus. Then vaginitis, pelvic inflammatory disease. For this, you can watch a video on our channel. Then adenomyosis and endometriosis, Fibroids, again a very important topic. Types of fibroids. Extra uterine fibroids is also important, so you should know at least the most commons related to the extra uterine fibroids and everything about the uterine fibroids. Urinary fistulas, infertility, very common topic asked in exams, and placenta, umbilical cord, and their related disorder. Short umbilical cord, long umbilical cord. Placenta is fixed at different places, and so because of that, various abnormalities can be studied in obs and gynae. Diagnosis of pregnancy. How will you diagnose that a female is pregnant? And all those things are very important. And further, physiological changes in pregnancy is important. Then maternal pelvis and the diameter of its inlet is very important. Labor and its stages, 4 stages of labor, and everything about it. Breech presentation, normal presentation we all know, but breech presentation is an important topic for exam. Ectopic pregnancy, most common site to rupture, and most common site with the longest viability for the pregnancy. That kind of thing related to ectopic pregnancy is important. Abortion and MTP, thus both are very important. And antepartum hemorrhage and postpartum hemorrhage, both these topics are important from the obs gyna related topics. And twin pregnancy, that is multifetal pregnancy. Molar pregnancy, gestational diabetes mellitus, very important. Diabetes is an important topic whether you study from any subject. Diabetes remains the important topic for foreign medical graduate exam or any exam in India related to medicine. RH incompatibility, this we discussed in physiology also, but it's in depth you will study this topic in obs and gyna. And pregnancy induced hypertension, eclampsia, preeclampsia related topics are very important. Contraceptions, ovarian tumor. In ovarian tumor, what you should know, the most, not everything about the tumor, but the most common related to the ovarian tumor and the tumor markers for each and every ovarian tumor is important. And stages is important for endometrium cancer and cancer cervix. Nothing else you need to remember about these tumors. In ovarian tumor, most common tumor markers, and in the endometrium and cancer cervix, you should know the stages very well. Now, talking about another important subject, that is surgery. In surgery, the first very most important, it is related to obs gyna only, but it is studied in surgery, that is triple assessment for breast. This you will also study in radiology, but it's better if you do it in surgery itself, because you will then in continuation study the breast related topic and breast disorders. Breast cancer is also very important. Breast related disorders is also important. Then thyroid, in every exam there is 1 question minimum. Maximum you can get 3 questions related to thyroid disorders and thyroid cancer. So you should do it very well. Either you do it from surgery or from medicine. I'll tell you to prefer from surgery itself, because most of you will not go with medicine as your subject for preparing the Fmge. So DVT, varicose veins, hernias, very important topic equally for Fmge and NEET PG. And testicular disorders, benign prostate hyperplasia. This you will study in various various subjects, but the main subject where you will study it in depth is surgery. And urolithiasis, types of stones is very important. Phimosis and paraphimosis, a penile disorder. And common surgical sutures, common surgical positions, which position is done for which surgery, that is important. So common surgical positions, types of surgeries, surgical nutritions, post-operative complications of surgery, hypovolemic shock, again important topic, 1 or 2 questions in every exam has been asked. And sepsis score, that is SOFA score, and related thing is important. ATLS, advanced trauma life support, and GCS, that is Glasgow Coma Scale. So Glasgow Coma Scale, you can watch a video on our channel. And flail chest, that is fracture of at 2 different sites in more than 2 consecutive ribs of fracture, that is called as flail chest. So that flail chest definition is always important. It is asked which of the following is true about flail chest, and the different types of definitions are given, and you have to choose one. So the definition of flail chest is important. Brain injuries, Everything related to brain injuries you should study in surgery as well as from radiology, and it is a very important topic. You'll get at least 3 to 4 questions from this topic. Then burns, you'll do it in FMT, but once again you should do it in surgery also. Then in trauma, that is most common penetrating trauma, most common blunt trauma in children, in adults, that kind of thing in trauma is very important. Grades of liver and spleen injury is an important topic. And going further, what else is important? Tension pneumothorax, hemothorax, and cardiac tamponade. Cardiac tamponade, once again, you'll study in medicine, but I'll tell you to prefer it from surgery itself. And congenital anomalies of GIT, that is congenital anomalies of esophagus, stomach, intestine, and hepatobiliary system is important. You can cover it from pediatrics, but we have left it from the pediatrics, and we have opt to cover it from surgery. Then achalasia cardia, third, gastroesophageal reflux disease, esophagus cancer, acute and chronic gastritis, cholelithiasis, and cholelithiasis. Any topic related to stones is important that in India for any exams. And appendix and appendicitis, inflammatory bowel disease, carcinoid tumors, hemorrhoids, fissure in ano and pyloneedle sinus. So these were the important topic related to surgery. Now if we'll talk about medicine, murmurs is very important, cardiomyopathy is important, HOCM is important. Medicine, I have cut short everything, and very important topics I have mentioned. I have not went into the depth of medicine, that all the topics and the relative topics which are important. I have just mentioned those topics from which I have seen questions being asked every time. So murmurs, cardiomyopathy, HOCM, rheumatic fever, cardiac tamponade, infective endocarditis, jugular venous pressure, ECG also, myocardial infarction, atrial fibrillation and flutter, PSVT and left ventricular and right ventricular hypertrophy. This ECG is very important. Types of pulses, diabetes, as I said, in any exam in India, it is very important. Pheochromocytoma, Cushing's disease, Addison's disease, Bartter and Littleman and Little syndrome, that is renal disorder, and Zollinger-Ellison syndrome, celiac-Spruce celiac disease, electrolyte imbalance, that is acid and base imbalance, types of kidney stone, and Crohn's and ulcerative colitis, Guillain-Barré syndrome, syringomyelia, multiple sclerosis, myasthenia gravis, Alzheimer and Parkinson's disease, CSF analysis. You should know to do the CSF analysis very well. Types of headaches, very important. Every time a question has been asked from this topic. Hence, SLE, scleroderma, gout, rheumatic arthritis, sarcoidosis, very important. Markers of sarcoidosis, hepatitis. Hepatitis is also a common topic, whether you study from any subject like diabetes, it is very important. Wilson's disease, hemochromatosis, cystic fibrosis, TB in India, very common disease, so TB is also everywhere important. Lung cancer, again most common cause of death related to cancer. Types of respiratory failure is very important, and ABG analysis, you should know the ABG analysis very well. So that was all the important topic from Obs-Gyna, P.S.M, medicine and surgery for your exam. Till now we have covered all the topics, all the subjects up to this video. Only we are left with the short subjects which we will discuss in the upcoming video. So thank you for watching this video. Hope you find it useful. Please like, share and subscribe my channel, Meddy Simplified. Thank you.